Hi, Theresa. My name is Alyssa Milazzo. How are you?
I'm good. How are you?
Good. I brought you a copy of my resume.
Oh, thank you.
I met some of your staff while I was in the waiting room. They're so nice.
Oh, good. I'm glad. So tell me a little about yourself.
Well, I'm a recent grad of Ithaca College right downtown from you guys.
Yeah.
DPT program, so I have my doctorate in physical therapy. While I was there, I completed a nutrition minor. And for all 4 years of undergrad, I played club volleyball, and then I've been coaching the team for the past 2 years.
Oh, that's awesome.
So I've had some nice hands-on work with the athletes. Yeah. Other than that, in my spare time, as you know, Ithaca is gorgeous.
Yes, it is.
So I love to spend my time outdoors, hiking, very athletic, so, playing volleyball all the time and stuff like that.
Right. So what are some of your strengths and weaknesses?
I would definitely say for my strengths, I'm a really hard worker. I'm very dedicated when I find a cause, and such as like physical therapy. So I know that once I put my mind to it and have a patient or something like that, I really go all in basically. I really push myself to make sure everything's going well and that it's the best care that I can give. I would also say that I'm pretty flexible. In a lot of my clinical rotations that we did throughout the school, you do 4 in your grad years here. A lot of them required me to be very flexible with hours, and therapy schedules were always changing and everything.
Yep.
So I've learned to be pretty accommodating with that.
Yes, we need that.
And I also would say that I'm a pretty big people person. I really find that it's great when you can make such a connection with a patient, and that almost brings up their level of care just off that basis. If you can really connect with them, they feel better, you feel better, that they feel better.
Yeah.
And it's just like a positive cycle.
Yes, a win-win.
Yes. As for weaknesses, I would definitely say one of my weaknesses is that I tend to overbook myself. I find that I'm really interested in so many things that I commit to a lot of them, and I definitely would say that it forces me just to be on top of myself. Like, I just need to make sure that everything is scheduled right and that things don't fall behind. And as long as that happens, then I should be good.
Good.
I would also say another weakness I have is sometimes I'm a little bit too hard on myself. When things don't go as life plans, which most of the time they never do, that I tend to think about it and criticize myself a lot, and I guess take a lot of time to reflect on that. Yeah. Just because no one wants to make the same mistake twice.
Right.
So just always kind of trying to better myself in that realm.
Good. So what interests you about this job here at Island Health and Fitness?
Well, being an IEC grad, we had a couple of your employees as our teachers, and they were always saying such positive things about that. We had Hillary Greenberger and Dr. Winslow, for example, and they had always positive praise about the facility. And so that's where I first got my kind of intro into Island Health. And then when I've been looking you guys up, and since I've heard such great things, that you guys are really dedicated to helping back the community. You guys... your target demographic is everyone in this community, and you really cater to their needs. Even with the staff here at IC, they run the on-campus clinic, and they have the rotations where we get some of your staff to come and help us learn, and it just, again, kind of like a positive cycle, like people just helping other people get better. I would also say that you guys, what really interested me was you guys recently partnered with the U of R School of Medicine. Our school partners with them as well in doing the cadaver lab. And so being at University of Rochester for a full summer and getting that experience was life-changing. And the facility is great and all their employees are great. And to know that you guys are paired with them and have the same level of care and same level of commitment to excellence it really interests me a lot.
Good. So is there anything else you're very interested in our whole organization?
Well, I think that your organization has a lot of chances for furthering education. You guys offer the clinical continuing ed courses,
yeah,
as well as some spine rotations, I guess you would say.
Yeah, yeah.
And so those are just great options to always have, because PT is a lifelong process. You're always learning. Every day is something new, and if I can continue to further myself and better myself as a physical therapist, then I think that that's probably the most rewarding kind of job that I could have.
So what experiences have you had that has prepared you for this job?
Well, my last clinical rotation was an outpatient orthopedic,
Okay.
And I really felt that that was the place for me. You know, the pace of it, the diagnoses I was seeing, the range of patients from younger athletes with acute injuries to older patients with specific more ailments to that kind of population.
Right.
It really, outpatient ortho keeps you on your toes, you know?
It does.
And it's so rewarding because you're getting to treat all different types of things. And like I said, I played volleyball at school and I also coached it. So I've been working with athletes hands-on for a long time. At school, I also participated in the PT-AT clinic, which kind of combined the two, got the best of both worlds. And I got to work with physical therapy patients, but in an AT kind of setting, which focused a lot more on athletic and sport injuries. And I felt that those opportunities really helped me figure out that this is what I want to do. I want to help athletes and I want to help people of all ages.
Cool. So where do you see yourself in 3 to 5 years?
Well, in 3 to 5 years, optimistically, I would love to be at your facility. This is a wonderful facility. And I see myself being more of a specialist within. I know that you guys push for a lot of your therapists to come in and then become something better of themselves. You're always pushing everyone to be better, which is one of the best qualities Island Health has been known for. So I know, for example, Brian Lee, when he came in, he was a therapist, but now he's especially foot and ankle. And it's similar to him, I would like to kind of develop my own little niche and work with the athletes and then also have that subspecialty within your team, just helping add to the greatness of Island Health and Fitness. I wouldn't mind giving back to the community like you guys do a lot and potentially helping teach at Ithaca College. Some of my favorite professors are the ones that come from your clinic, and their teaching is invaluable. So I really think that if I could do that and get a chance to help the community back, that I would be really doing a service to everyone.
That's great. So do you have any questions for me?
So like I was mentioning before, I know that you guys have a lot of subspecialties. Is there any area that you guys are still looking to push forward and develop? Like women's health or anything specific like that you would be looking for someone to help go in that direction?
That's a really, really great question.
Thank you.
We are always looking to expand our horizons, even if there is one, say, foot and ankle or one spine specialist. We always push for people. So if you would like that too, and we have 2 of them, that just makes us even better. So you don't have to necessarily be your own. Whatever you want to do, that will help you do it.
Some opportunity to grow.
Yes, exactly.
Also, one more question. What's a typical day like in the therapist? Like, how many patients do they see a day?
Well, it definitely varies between how many hours are there. In our clinic, we do the different rotation schedules so that we have therapists there early and late. So on a typical day, you'll see at least 2 to 3 patients every half hour. So do the math. Yeah,
So
really,
you're
we
moving,
go.
yeah.
Yep, we bring them in and out. Our sessions are usually an hour long, though. We still treat if they need to be longer than an hour. They are. As you know, we just take care of our patients.
Gotta stay flexible.
Exactly.
Alrighty. And also, before I leave, can I have your business card so I know who to contact when we're done?
Of course.
Thank you so
There you
much.
go. It was nice to meet you.
Nice to meet you. Thank you for this opportunity.
You're welcome. Hi, Alyssa. I'm Theresa Ferrante.
Hi, Theresa. Nice to meet you.
I brought you a copy of my resume,
Thank you very much.
and your facility is beautiful.
Thank you. Recently updated. Alrighty, Theresa. Tell me a little bit about yourself.
Well, I just graduated from Ithaca College, the Doctorate of Physical Therapy program. I was a health minor, so I got a little health aspect of that. I was also pretty active within my college community. I had I spent a lot of time doing community service with Circle K. I was in our physical therapy club as like a class representative. I spent a lot of time at the fitness center. I worked there as a student manager. I was also a personal trainer. I did some clerical office work on the side just to kind of help everything go.
Okay.
Besides that, I just like being outdoors. Ithaca's beautiful, so I was always hiking and being in the gorges. So
Yeah, you're telling me. I love Ithaca.
yeah.
Alrighty, Theresa. So now that I know a little bit about you, what would you say are some of your strengths?
Well, As I just said, I was a student manager at the fitness center, so I would say I'm a pretty good leader. I also think that I was a good team player at the fitness center. There was 6 of us that were team managers, and we would always work together every Friday to kind of talk about what's going on, what's going well, what's going bad, and always trying to improve the fitness center as much as we can. In the 6 years I was there, we made some drastic improvements, which is I'm pretty proud of. It's nice to see that I made a difference. Besides that, I'm pretty creative. I like to think outside of the box. We had a few projects in school. I just love doing them. They're fun. It's good to kind of get another side of
The
my mind
PT
working.
life,
Yeah,
yeah.
exactly. And last, I'm just passionate. I love working with people. I love helping people. So I'm a personal trainer. I've worked with kids forever. It's just nice to help them in a way that I can.
Yeah, so you said you're a personal trainer. Do you see that correlating a lot with yourself in the future of physical therapy?
Yeah, I mean, I like that aspect of it, like fitness, getting people on the track to wellness and everything. So that's why I began personal training originally to help interaction with clients, and it's helped me so much.
Very nice. Now that I know some of your strengths, what about your weaknesses?
Definitely lack of experience within pediatric physical therapy. I've worked with kids several times, as my resume shows, and as I'll get to, but I haven't worked with them in the therapy setting, and I'm anxious to build on that and learn. Another weakness I have is I'm very indecisive. I get nervous and I'm not going to make the right decision, and I want to be perfect, and I want to make that right decision, and usually it takes me a few minutes to kind of weigh out all the pros and cons and make the best choice.
Better to weigh it out than regret it at the end.
Exactly.
Okay. So what interests you specifically about working here at this job?
Well, like I said, I love working with kids. I've worked with kids since I was babysitting my 12-year-old cousins, and so I just like that I can work with kids and have them get better by playing almost. So working that therapy into their sessions by doing fun games, activities. I also like that you guys work with kids with different diagnoses. You said on your website you have cancer patients, brain, and any injuries. So it's cool that you see a lot of different patients. I also like that you get to change a child that's so young. I mean, when we in outpatient ortho clinics, you can help someone recover from a shoulder injury and they're on their way. But these kids, this is their lifelong. They need to be fixed or helped from day one. So that's really motivating. That I saw that video about the miracle child on your website.
Oh, wow.
And John's mom was talking about how it's changing him for his whole life, after graduation, after this, after that, that this therapy is changing his life, and I would love to be a part of that.
It is very rewarding, I can tell you that.
Yes, I believe it.
And so specifically, you're interested in our clinic of PEDS. Why us? Why are you interested in our organization?
I saw on your website that the Commission of Accreditation of Rehab Facilities, they endorsed you for your pediatric specialty accreditation, which I think is awesome. I think that shows me that your company is committed to what you believe in and that you're setting yourself at a really high standard. This is important to me because that's what I want to work at, a place that I strive to be better and I strive to meet those goals of your facility. I also see on your website and I see stories that you guys are just dedicated to the patient but also the family. So you're working everyone in there. Again, with John's mom, he was just so happy, or she was so happy that they cared about her too and not just him.
Yeah, we really try and encompass the whole family aspect. And so what experiences have prepared you for this job? I know you said you worked with kids your whole life and everything, so building off that.
So I babysatted, like I said. I worked at the Cornell Sports School, so I worked as a camp counselor for a summer. But then I also worked for BOCES, which is working with kids with special needs. So one summer I worked as a one-to-one aide with a kid who had brittle bone syndrome. So I was fortunate enough to go to his PT sessions, which is where I kind of got started on the whole idea of working with kids.
Wow.
So I got to work with him. It was also interesting because he was nonverbal, and we had 6 kids in the classroom, 5 were nonverbal, so it was really eye-opening, and you really had to think outside of the box on how am I going to get him to do this, and how are we going to communicate when he actually can't tell me what he wants. So that was just a great experience, and I always subbed back when I was home from schools and stuff, so I would always keep getting in the school district and working with kids as much as I could.
Very nice. Sounds like you really had some good experiences there.
Yeah.
So based off what I've heard, what do you see for yourself in the future? Let's say in the next 3 to 5 years, where would you put yourself?
Great question.
Thank you.
I would love to be working in a facility with children. If it's this one, that would be awesome. If it's a different one with different needs and wants, I've always wanted to work with kids, and I've always wanted to be in that type of setting.
Mm-hmm.
I also could see myself continuing to take continuing ed classes to just keep learning, keep extending my knowledge. And even if I find a niche I want to start working on a certification, just for that, just to really be able to work on a specialty.
Very nice. That sounds good. So do you have any questions for me?
Yeah, I have one. I saw on your website you have that outpatient care after they graduate from our inpatient.
Mm-hmm.
So is that something that I would just excuse them, they would go on to that, or would I ever see them again? Is that how that works?
Well, I think what happens is once they start their outpatient care, you are still a part of the process, and it's kind of more of a weaning off process, whereas you would continue your therapy because you know them best, and as they progress slowly but surely out of our care into the more outpatient realm, they would start seeing you less and less because your main demographic is with our children.
Oh, okay.
So you would still see them and still be part of their plan of care, but eventually once our services aren't needed anymore, you would be done with them.
Okay. That's
Alrighty. Thank you so much for your time, Theresa.
Yes, thank you very much.
Lewis, thank you so much for seeing me today. I brought a copy of my resume for you. I just wanted to compliment you on a beautiful facility you have here.
Thank you. So tell me a little bit about yourself.
So I'm a recent graduate from Ithaca College. I graduated with my doctorate in physical therapy. I had previous clinical experience from my last fill at an orthopedic outpatient facility, which I thoroughly enjoyed. For my 4 years of college, I was on the swim team and the dance team. And I'm also an involved member of the ABTA when I attended the New York State Student Conclave and Conference.
Good. Tell me a little bit about your strengths and your weaknesses.
So I think from being on the swim team and dance team, I know I can work well together. I have a great team work aspect to me. I also build great relationships with patients, and which I think can be a downfall as well because I get too attached and too involved with their treatment, their stories. And then I'm also a perfectionist, so everything I do has to be perfect, which I also think can lead to a weakness where I try everything and anything to make a patient get better.
What interests you most about this job and about our organization?
So I think being able to work so closely with the athlete population, especially being an athlete, really interests me. I also like being able to take patients from the therapy program and transition into the fitness part of the program. And I like how you guys focus on the therapist aspect, so gaining continuing education courses, mentorship, and the fellowship and lecture series you have here.
What experiences have prepared you for this job?
So I think through my experiences at that outpatient orthopedic place really helped me. So we had a lot of athletes come in and just saw a general orthopedic injury population. So we really were committed to kind of switching their therapy treatment to focus more on their sports or what they wanted to get out of the treatment. And then I also got the opportunity at school to work as a student physical therapist at the athletic training center here and working with athletes hand on hand. So I think that was really cool and a cool experience for me.
Where do you see yourself in 3 to 5 years?
I see myself hopefully practicing here, physical therapy, and continuing my education and gaining just clinical experience because I'm just a graduate from school, and hopefully getting my OCS certification. I'd like to strive for that.
Do you have any questions for me?
I was wondering if all your therapists eventually become a specialist in a certain area and basically that's.
We like to see most of our therapists kind of further their education within the first couple of years of being here.
And do you have a business card I can take with you?
Yeah.
Thank you.
It's very nice to meet you. Thank you so much for taking the time to interview me today. Here's a copy of my resume for you to have.
Thank you. So we're going to start off. I want you to just tell me about yourself.
Okay. I am a recent graduate of the Ithaca College DPT program. I was also a track athlete for 4 years while going to school there. I just completed a clinical in Endicott, New York. It was an outpatient ortho setting where I saw a whole array of ages and diagnoses. I really enjoyed working there. I also nanny part-time on the side, so I work for a local family. I really like working with kids, so it's the perfect job for me right now.
Can you tell me about your strengths and weaknesses?
I would say a strength that I have is communicating and working with other people. I think that plays a hard role, and when I was on the track team, I was very good at working as a team aspect. I'm also good at talking with patients, talking with their families, or even communicating with other coworkers. Weaknesses, I would say I have a hard time saying no to people. I like to make people happy, and that's part of the job, I guess, but I sometimes take on too much because I'm unable to say no to like coworkers or manager positions.
Can you tell me what interests you about this job or why you're interested in this organization specifically?
Working with peds is my dream job right now. I love working with children. This is a beautiful place. I'm amazed by the background of this place and how like just a small group of women could start this whole thing from one bed. Working with kids is everything I want. I want to like help them and like also have fun at the same time so they're getting better and enjoying it.
What experiences have prepared you for this job?
I would say my experience started when I started working with a local family who has a 10-year-old daughter who has spina bifida, and I would help take care of her when she needed me, and I would go to physical therapy with her, and the physical therapist would let me help in or like explain to me what they were doing. So that's kind of where I got my start. And also at my last clinical, I worked with a lot of younger children. Whenever they would get them, they would send them to my CI and let me work with them. There was some with torticollis or clubfoot, and then even up to like teenagers, like sports injuries and different stuff like that.
Good. Where do you see yourself in 3 and 5 years?
I see myself working at a pediatric clinic, hopefully this one. It's an amazing place. I also would like to become a certified pediatric specialist within the next couple of years.
Do you have any questions for me?
Is there a lot of like advancement opportunities for your employees, like continuing ed classes and stuff?
Yeah,
like that?
we try to get our therapists out in the world of getting educated, even, again, like you mentioned, a pediatric specialist. So there's a lot of opportunities.
Okay. And do you have a business card?
I do. Here you go.
Thank you so much.
Hi, Amy.
Hi, Jess. It's nice to meet you.
Thanks so much for taking the time to meet with me.
Absolutely. My pleasure.
Yeah, I know you guys have 85 locations, so you probably keep very busy.
Yeah.
This is also a copy of my resume. I just wanted to give you that before I forgot.
Great. Thank you.
Yeah, no problem.
I definitely got your email though. So.
Oh, with the e-portfolio?
Yep.
Yeah, that's
Yep.
good.
Good. So why don't we start off? Tell me a little bit about yourself.
Well, I just graduated Ithaca College with my DPT. I was a business minor also. My senior year, I got the Dean's Award and the Professional Development Award, which were great awards to get. I played on the Ithaca College women's soccer team for the past 4 years, and then the last 2 years of my school year, I was a volunteer coach, which was a good experience to see the other side of the field. I'm LSBT certified, and which was cool because for my last clinical, I was able to use some of those skills again and actually see them in action. I was able to attend the 2015 New York State Albany conference for the PTA, so that was great because I got to see what a continuing education course was really like and get to hear about some of the issues that are happening in PT today from real clinicians. So that was an amazing experience too.
That sounds excellent. Why don't you tell me a little bit more about the clinics the affiliations that you went on, the clinics you worked in?
So at Ithaca College, they actually have a clinic on campus, which was a great experience because before I even went out on my first affiliation, I had already worked in the PT clinic on campus. And so I already knew what it was like to talk to patients, try to explain to them, medical things when they don't have the medical terminology basis. And so then on my first clinical, I was ready to go already. And ever since then, my clinicals 1 through 4 have been really great learning experiences for me.
That's excellent. Yeah. Do you want to give me some strengths and weaknesses that you have of yourself?
Sure. So I'm very excited to start practicing physical therapy. I've been in school for 6 years, and I feel like my teachers have been giving me tools to put in my toolbox and take them out when the time is ready. So I'm really excited to be able to decide on my own what tools I want to use, and not to have a CI there to check in with, which is both a scary thought and a good thought. But so that would be one of my weaknesses, that I'm a new clinician, so I don't have much clinical decision-making experience, and I'm not used to not having someone to check in on me like my CI would used to do.
Right. So what interests you about this job?
Well, I really like that you have a neuro rehab unit in focus. I did my last clinical in neuro rehab, but I like that it's not just neuro rehab, that I would be seeing patients all along the spectrum, really get to use a lot of the tools that are in my toolbox right now that I could try out. And I think this would be a great learning experience, and I think that your clinic has a lot to offer, and I would love to try it.
Excellent. And what else interests you in our organization?
Well, I love that you guys seem very patient-oriented. Like I saw on the website that 98% of patients would recommend this clinic to their friends and family, and I think that really resounded with me. I was very appreciative of all the relationships I made with my patients on a fill, and I was very hard on myself when a relationship wasn't going so well, or just in general a therapy session didn't go so well. So I'm very patient-oriented, and I really like that about your clinic too.
That's excellent. We are very patient-oriented, so
Good.
that's a big part of who we are.
Mm-hmm.
Can you elaborate on some of the experiences that have prepared you for this job?
Sure. So like I said, I worked in the PT clinic at Ithaca College, and that just really got me very excited to be working as a PT very early on. I think I did that my third year in school. And then after that, the 4 affiliations I went on all were different. Like I did an outpatient, and then I did an inpatient. Then my last one, like I said, I did a neuro rehab in Vermont, which was a great experience and what led me to this organization.
Excellent. Now the big question, where do you see yourself in 3 to 5 years?
That's always a tough question, especially when you're a recent grad, but I love the idea of working for this organization, and I think that I would love to work here, and I can picture myself doing more continuing education courses. Like I said, I'm LSPT certified, but I have many other things that I think I'd be interested in. Like I saw on your website that you were advertising that you kinesiotape a lot of different diagnoses, and I did that on a few of my fills, and I really thought that was interesting, and I'd love to look into that as a continuing education course too.
That sounds great. Do you have any questions for me?
Yeah, just what resources do you offer to your therapists for continuing education courses?
Right, so with all of our different locations and our many therapists that are a part of our organization, we do have a substantial, amount to give back to our therapists so that they can give the best care to their patients. So we're very strong about sending our clinicians to continuing education programs.
That's awesome. Yeah, I have a lot of different interests that I would like to pursue, so I think working at your clinic would help me kind of narrow down what exactly I want to focus on as my niche of practice, and then continuing education would be amazing.
Excellent. Yeah, sounds great.
Well, thank you so much for taking the time to meet with me.
Absolutely. It was a pleasure to meet you, Jess.
You too. Thank you.
I'm Aimee.
Hi, Aimee. Nice to meet you.
Here's a copy of my resume. I just wanted to give it to you.
Thank you. So tell me a little bit about yourself.
So I'm a recent graduate from IC. I just completed my DPT. I was also on the volleyball team at school, so I was very involved in sports, which sort of what led me to doing physical therapy in the first place. And I completed a bunch of affiliations while I was at school, one of which was a neuro rehab, and I was actually able to work at the clinic on campus with more neuro rehab patients.
Cool. Tell me a little bit more about that clinic on campus.
So we would meet twice a week for a whole semester, and we would work with patients who were in the community who wanted to get more rehab in their daily life, and we would sort of help them with gait, balance training, things that would help them with proprioception and things like that. We would also help them with stair climbing if they lived. A lot of our patients, they they stay at Longview, and there's a bunch of stairs there, so we work on stair mobility and things like
Sounds like a good experience.
that.
What would you say are some of your strengths and weaknesses?
So I would say, as everyone else would probably say, my weakness would be that I've just graduated and I haven't had much independent experience. But I'm very passionate about the job. I always put the patients first, and I try and incorporate all of their support with family and friends and helping them through their rehab and their therapy because, like you guys believe, I think that if you incorporate all of those people in their rehab, they're going to get better, quicker, and they're going to get stronger, and it'll be a better rehabilitation for them.
Good. So you seem very patient-centered.
Yes.
Yeah. What interests you about this job?
So your reputation is, the highest of the pack, and I'm actually from the area, so I'm very familiar with the community and, how renowned and well-known you guys are, and, how much time and effort you put into your patients and the outcomes that you guys get from working with them. I also noticed that you guys are very up to date on your technology, which I think is great. I love technology. I love, being innovative and using new things with patients during therapy. I think it's very, beneficial for everybody.
Are there any other interests in the organization that you have?
Yes, actually, I'm very interested in the research that you guys do, and I hope to be a part of that someday to get both sides of PT, to help the patients one-on-one, and then also maybe do some of the background things that people don't necessarily think of when they think of PT and they think of physical therapy and rehab. One of the things that I saw on there was you guys are working on restoring lost functions after spinal cord injuries, and I thought, doing that with a combination of PT and other treatments is great research. So I would maybe want to be a part of that one day.
Yeah, that sounds great. What experiences do you think have prepared you for this job?
Like I said, the affiliations that I went on and the fact that I worked in the clinic on campus at IC really helped me with my skills and patient interaction and, making sure that they get the best rehab that they can get.
Good. Where do you see yourself in 3 to 5 years?
I definitely see myself doing continuing education classes. I think that's something that's very important because as such a new, job and, career, the PT is always growing, and so I think it's very important to stay up to date on all of that education. So that's one of the things I see myself doing. Like I said before, I'm very interested in the research program that you guys have. So I hope to do that as well.
Awesome. Do you have any other questions for me?
I do. I have one question in particular. I noticed that you have both inpatient and outpatient sort of at the same time with the patients, and I wanted to know how those worked, how it runs in the facility. Do you guys follow each patient, or once they go out to outpatient, that's sort of when you see them?
We do a little bit of both here. We have some therapists that do strictly inpatient, some do outpatient, and some like to follow all the way through. So we can work with you one-on-one about how you would like to handle your schedule.
That sounds good.
Okay, well, thank you very much for coming in today.
Thank you. It was a pleasure to meet you.
Thank you.
Hi, Dr. O'Brien. My name is Caitlyn Maskell. It's nice to meet you.
Thanks for coming in today.
Thank you for having me.
Thank you for your resume. So, Caitlyn, tell me a little more about yourself.
Okay. I'm a recent graduate of Ithaca College. I just graduated this past year with my doctorate of physical therapy. While I was at school, I was able to do a lot of volunteer work. That's definitely something that I enjoy doing in my free time. I was a part of a team that helped raise money for the ALS Foundation for research in the cure to Lou Gehrig's disease. I was a part of that all through my undergraduate years, and I did that with some friends, so it was a great learning opportunity. I also was able to volunteer in the local community at a soup kitchen where I was able to get to know many members of the community, including my fellow volunteers, but also some of the great people who make up the community of Ithaca.
Great. So tell me about your strengths and your weaknesses.
Okay. One of my weaknesses, I would say, would be that I'm a perfectionist of some sort. I'm a natural people pleaser, and I've learned through my affiliations that sometimes I'm not going to get the results that I want in a treatment, or a treatment isn't going to go the way that I had planned for it to. But on the flip side of that, I've also would say that I've gained the strength of being able to adjust according to the patient and make sure that I provide the best quality of care to them that they need.
Good. So what interests you about this job?
I'm very interested in working for your company because of your unique approach to rehab that you have. I read on your website that Dr. Kessler was very into having a treatment for the whole individual rather than just the medical diagnosis that they're coming in for, and that's something that I would like to continue to keep practicing as I go throughout my career. I also like the fact that I would be able to work in both the outpatient and the inpatient settings. I was able to work in both of those while at school, and I found that you learn great things from both, and it tests your whole realm of knowledge.
And between inpatient and outpatient, do you have a preference of which setting you like better?
I definitely liked outpatient. I liked the fact that I was able to see so many different patients throughout the day, but I also did enjoy the inpatient spectrum where you went up to a patient's hospital room and you really got to see them right as they were starting their rehab process. So they both have their place in my heart.
So why are you interested in our organization?
I'm interested in your organization because I have seen that you guys do a lot of research into the medical field, and I would like to help continue that practice, and I would definitely be interested in doing research. I also love the fact that your organization has a community program that helps reintroduce the patients to everyday real-life events. I like that you take them out on field trips and you're able to give them that experience because the clinic can only give you so much of that real-life experience.
Okay. And what experiences have prepared you for this job?
Working at my clinical affiliations, I was able to work with a multitude of different patients in all different settings. I specifically enjoyed working with patients with the neurological disorders. I specifically worked with one patient who suffered from a stroke, who I was seeing for balance impairments, and one day he came in and he expressed to me that he felt that physical therapy wasn't really working for him, and I was able to reevaluate him with the Berg balance scale and some of our other functional outcome measures that we did on his initial eval, and I was able to show him that physical therapy was improving his balance, and I was able to keep him coming to us and keep him motivated about physical therapy. So that's something that I definitely think prepared me.
Yeah, great experience. Where do you see yourself in 3 to 5 years?
3 to 5 years. I would like to continue my education. I know you guys offer a lot of continuing ed courses, and I'm a lover of knowledge, and I would love to be able to keep furthering my knowledge about physical therapy, and so hopefully I'll be even more knowledgeable in 3 to 5 years.
Perfect. Do you have any questions for me?
I did have one question. I was wondering how involved your clinicians are in the research. I wasn't sure if you guys had your own separate team or if they also helped out with it.
Our clinicians are involved. It depends how much interest they have into the research perspective, but there's definitely opportunity for you to get involved in the research.
Okay, great. Well, can I grab a business card from you?
Of course.
All right. Thank you for meeting with me today.
My pleasure. Thank you. Hello, Dr. Maskell. How are
Hi.
you today? Here's a copy of my resume.
Thank you.
Thank you for taking the time to meet with me today.
Well, thank you for coming in and talking with us. So why don't we start off by having you tell me a little bit about yourself?
Okay, great. I'm a recent graduate of Ithaca College's Doctor of Physical Therapy program. While there, I was very much involved in the APTA, the NYPTA, as well as the Ithaca College Student PT Association. I also attended multiple conferences such as the National Student Conference and the Combined Section meetings. I also participated in Lobby Day in Albany, New York, because I thought it was very important to advocate for our profession and not only see the legislative portion of what goes on as well. I also did a lot of charity work, and my school was involved in the PT Day of Service, so I helped organize that. I find it very important to give back to the community and just be a part of the community in Ithaca as well as the college too.
Mm-hmm. Okay, great. Why don't you tell me about some of your strengths and weaknesses that you find?
Some of my strengths, I feel like I make a great rapport with patients. I'm a very compassionate therapist. I spend a lot of time one-on-one with patients, and I really try to get their trust and build on that patient-therapist relationship. Sometimes, however, I do find myself spending a little too much time with them, and then my documentation documentation gets a little backed up.
Mm-hmm.
But I'm also a recent graduate, so I've always had a CI signing off on my notes.
Mm-hmm.
But I really do think that through the skills I've learned at college and through my affiliations, I've built up the skills and can work on my own, and I'm confident, and I can deal with the complexity of neuro patients, and I really believe that I am ready to start practicing.
Great. So tell me what interests you about this job.
Well, I'm interested in the position because your facility offers not only inpatient but outpatient. I also noticed that your facility treats a wide number of impairments, spinal cord injury, traumatic brain injury, amputees. So I really appreciate that you specialize in a bunch of different areas, and you have the technology and you have the research behind it to support the patients and give them the best care possible.
Great. So why don't you tell me what interests you more about working with our organization?
Well, like I said before, I'm really into giving back to the community and being charitable. I really admired the Henry H. Kessler Foundation. I looked into that, and I really admired that, as well as I looked and saw that you have a driver rehab program.
Mm-hmm.
So not only are you working with patients, inpatient and outpatient, but you're getting them back into the community. And I really liked that program because I think driving is really a sense of independence for patients. And after going through rehab, you're not just throwing patients out into the real world. You're trying to get them back into the community and back to living a normal life. And driving, to me, was one of the most important things to being independent, and I really admired that program.
Okay, Nicole. So why don't you give me some examples of past experiences that you think will help you in this job?
Right. So through my experiences while at Ithaca College and my clinical affiliations, I've worked with a broad range of neuro patients. Specifically at Ithaca College, in the aquatics program, I worked with a patient who had MS while in the pool and really helped her balance, and she had issues dorsiflexion and plantar flexion. So we were really working on that. I also worked with patients in the clinic, specifically a patient who had a spinal cord injury. So just trying to motivate them and inspiring them to do better and to want to come to therapy, and thinking outside the box as well, not only things that would work for normal orthopedic conditions. My patients couldn't perform, so just trying to think outside the box, what's going to work for them,
Mm-hmm.
what's going to get them to be motivated and inspire them to want to do better.
Great. So I have one last question for
Sure.
you. Where do you see yourself in 3 to 5 years?
In 3 to 5 years, I see myself working at a facility such as yours, continuing my education as well. I hope to become a board-certified neurologist specialist in 3 to 5 years, so it's something that I inspire to be in the future.
Great. Do you have any questions for me at this point?
I do. While searching on your website, I noticed that you offer continuing education courses at your facility. Is that something that employees will benefit from, such as, like, will you provide payment for those types of classes?
Yes, we definitely do. We want all of our employees to get the experiences that they wish to have and to keep them learning new techniques and whatnot about rehabilitation. So we would definitely be able to help you out with that.
All right, sounds good. Do you have a business card that I could have, please?
Of course I do. Thank you for coming in today.
Thank you for taking the time.